All right, so this is Senate Health and Welfare. We're back. And we're going back to look at our budget priorities for things that we heard about in the public hearing, and there are things that we've heard about from other folks. And we want to set some priorities that we can take down the hall, and I'd like to take them down the hall today. So this is it for us. And I know there are a lot of things that are already in the budget. We're looking at those that we understand and not. So I know Senator Kulik, you had a list of things that you are, I'm just gonna ask each person to give me your priorities, and we're gonna list those as a team and then see where we get to.
Well, I mean, I want to fund everything, so, but
Okay,
there's
you're-
that would be amazing.
So we'll move on now to Senator Weeks. Go ahead.
A few things that, came to the fore for me, although this is not a necessarily exhaustive list, is the SASH pilot program. I would like to support the, Vermont Criminal Justice Reform, Health Center, or what are we calling it, Recovery Center in my district as well. I think they need funding to support folks, in recovery. And well, I also, and I wanted to discuss this with you, but I wanted to know what's happening with housing and shelter possibilities for social developmental disabilities.
We're working on that. I mean, I think it's being really well covered, and in economic development here and appropriations are just around. Yeah,
Okay.
I'll make sure to emphasize that.
But I'll leave it at that now.
That's it, okay.
Sorry, no, I sent you a second one, which was, Howard Mental Health for, liaisons for,
Cultural liaison. So what we're doing is just making our list of what our thoughts are. And then we'll try to put together something as a committee.
What, I'm sorry, I missed it,
Budget.
We're looking at the budget, Senator.
Yeah, I know, I know
We're looking at
that, I
What
know that.
wasn't funded in the budget, and then what we have from the public hearing. I've just asked each person to give us a list suggesting their priorities, and then we'll try to move.
was Senator Gulick the first one?
Yes.
Or, okay, I'm sorry, okay,
You only missed Senator Goodwin.
okay, that's fine, I just wanna make sure.
So,
SAG, she listed
I
SAG,
said everything.
Vermont,
Everything that,
I said something.
and we just sent her out of the room. But SAG, the Vermont Criminal Justice Recovery Center, the Howard Cultural Liaison. And so it's okay if you are redundant and you have some of those on your list, and you can also add. So I think we can all do that. Who wants to do next? Go with Senator Weeks.
First question on the H721. That wasn't on the list. I'm just wondering how it's being addressed.
So it wasn't, and I asked Nolan and Amy to put together. Nolan did a great job. They brought the list, and we'll have that list. We'll go back to that.
It should be
Yeah, it's posted, so we'll go back to our bill list after we've done. Okay, there you go.
So again, I'm not sure if it's going on, it's in a bill, but I'm not really sure if it's on that list, but it's on the list out yesterday, the day before. So EMS training, which I think was 8622.
Yeah, so it is in the bill. So I'm
So-
trying not to list things that are in the bills because we're gonna be listing the
The other ones
bills.
are listed,
Which,
the other ones are listed in the bill.
well, tell us what they are, just so we know.
No,
Well, it's
no,
helpful.
It's not,
It's,
it's just, it's not necessary.
okay. Sure, then we don't know. There's nothing else there that would, if there were available funds in the budget. Because some of the things that we're talking about,
EMS training, isn't,
yeah,
I believe.
but some of the things that we're looking at that are not in the House budget may well have been funded by the governor's budget. I know you're interested in that. All right. Who wants to go next?
I will have one,
Okay,
empty arms.
empty arms. Okay. And that's one-time funding, just so people
Right.
know,
Yeah.
and it's only to get fit up or started up as an organization, and then they won't be coming back.
Then I had the question from came from a constituent this morning, actually, it's, 3% Medicaid increase, there's concern that level funding is in fact going to be a reduction for, so community care network, and welcome to ask the question. Is that something we can get on the table to talk about?
We can put that down.
Okay.
So you're looking at an increase in Medicaid reimbursement, tell me exactly.
Well, it says, the question was the 3% Medicaid, increase. There's a concern that that's just gonna make, funding, in fact, a reduction in funding, and it's concerning about it.
So insufficient increase for the, for our designated agencies.
Correct.
Okay.
Is that because 3% doesn't cover inflation? Correct.
Yeah. Okay. Got to write it down. That's Vermont Care Partner. Okay,
So to that point, I know that the appropriations committee is talking about sort of rate increases for all of the designated agencies and the home health agencies, et cetera, and where is that at this point?
it isn't right now. We're still talking.
You're still talking about it, you haven't landed somewhere. Okay, so that would be a priority for me, is to make sure that we take care of those agencies.
So you're talking about, and this goes along with Senator Williams then, so you're talking about,
The designated agencies, the home health,
home health,
you know, all of the agencies that we provide kind of the
the
Medicaid,
VNAs,
yeah,
the
those
long-term cares.
kinds of,
Yeah.
you know, that we have obligations to and that they need to be able to pay their people.
So are you talking about general, just saying generally reimbursed at a higher level, or do you think it has, so Terry was talking, or with Senator Williams about making sure it's above inflation?
I haven't looked at enough analysis to know what the right percentage is. I mean, this list has a 6.5% increase listed. I don't know what the right percentage is. 3% probably is low because it's below inflation. So I don't know. I know last year I think we did 9% last year, or was that the year before? So I would want to make sure that they have the increase sufficient to make them whole. And included in that is the parent-child centers. I would include them in that list of
All right,
like.
well, but put them separately, because they have a separate ask, but you're right.
Yes, but
It's
just sort of like putting them on par with those agencies, sort of whatever that increase is.
Okay.
Frankly, you know, looking at this list, as you know, Madam Chair, it's my, you know, one of my priorities is H721. I know it's a bill, but I think that would have a huge impact on a lot of people. And so that's a big priority of mine. And I don't know where things are at with housing. And it's kind of been confusing to me what's going on with housing, and the housing bills and the conversation about housing. But one thing that is on this list is the housing for people with developmental disabilities.
Mhm.
And that's really important to me. You know, you and I and others have done a lot of work on that, and
Did you hear Senator Goulart?
I would hear about it.
I'm sorry,
Okay,
okay.
and I responded because I just spent a meeting this morning talking about making sure that that's in the bill. I talked with VHCB about it and Senator Braun, Senator Kitchell about it.
Okay,
So that is a committee priority. I guess I will put it down because it is our committee, unless others in the committee don't feel that way.
No, actually, I support it.
Yeah, so we'll-
I'm totally lost in what's in
Yeah.
and out and.
right, exactly.
Well, you know,
It is confusing, Senator.
Let's put it this way, As a policy, our committee believes it's critically important to have that type of housing available. That's our policy recommendation. And then how it happens and what distribution of funds is another question. There will be, this is important, and I will put it down, because I think we all feel that way.
I mean, the way I'm sort of, the lens I'm sort of looking at this through is the work that we have done collectively as a committee. We need to prioritize that. And I know that there are a lot of really awesome asks here. It's hard for me to say no to people and agencies that need money. But we've done a lot of policy work, and I want to make sure that our policy work is supported by budget work. So the other things, the SASH program that I think Senator Buick also just mentioned. I think that's really important. They have really great outcomes. That's also housing. And we've supported them and done work in that area as well. Again, the parent-child centers, there are a couple things on this list, adult day programs and dementia respite. I think they're actually connected. Dementia respite is often in our adult day programs. And so I want to make sure that we don't lose more adult day programs.
Apparently, I was under the impression that we were losing them as well, but apparently we're
They're
not.
stabilized.
They're stabilized.
Yeah.
We did some work last time, but it doesn't hurt just to mention that.
Yeah,
Let's
I
keep
mean,
them stable.
the adult day program in my district is incredible, and I just want to make sure that they get what they need. Similarly, and so another important part of our healthcare network is the FQHCs. So I would put them sort of in that group of agencies, making sure their rates are, and of course, the opioid settlements of the group that dealing with that, you just said 72, so, and then, what last thing I was gonna say, just to your point, Senator Weeks, that the EMS funding is also on the Government Operations Committee priority list, so I think it's covered in a couple of places. And the last thing is in the food bill, blanking on the name of the program that we did here.
The expansion.
The expansion of the SNAP program. I think it's really important that we do that study. And I think that the House put it in their bill, but I can't remember.
There was a discussion about that study yesterday, and we'll probably be coming back to it, but the way the study is written, this is a concern that some members of appropriations had, is it's written as an implementation plan.
Yeah.
So the intent there is if you do the study, you're gonna do the program. And funding for that, I guess, was a concern. So if the language can be, I don't know if the language can be modified by folks so that it doesn't read so much that we're absolutely gonna do it.
Yeah.
As compared with, let's look at it.
I think that would be fine, just having it as a study that we look at, and including the sort of studying the I will not say implementation.
How it would happen.
How it could happen, how much would it cost, and also the restaurant program, if we could do that too, in the study.
So that is something I think that perhaps a conversation with the Honor Court and Teddy would help maybe get some language together.
I'm certain they are listening if they're not in the room.
Yes, I know.
Try not to look at people as I'm telling people like, but they would be more than happy to do that. And I'm sorry if I missed somebody, and everything is a priority, but we have to skinny it down. And I understand more than anyone else, so stop.
Can I say a follow on to my comments?
Sure.
And I don't wanna sermonize, but I also don't wanna be flip. And my remark about funding everything, I actually mean that. I feel like we have a system with a huge inequality in terms of income. There's a huge gap. We have a baked in poverty mechanism or system that exists. We have trauma, abuse, addiction. I think it's government's role to help people who are victims of the system that we live in, so. When they don't do that, and when they farm the work out to agencies and nonprofits and whatever, I believe it's their responsibility, hence our responsibility to pay for it. And to support it, so I just want people to know that I really meant that when I said that,
We get it.
thank you.
So, yes, and it would be great. We could fund everything. So I'm agreeing with the folks who said SASH. And also with the cultural liaison at Howard Center. And also with Empty Arms. And then with as much as possible, funding our DAs above and our support services above that 3% level. That's it. I can't say I disagree with anything anyone said. Parent-child centers, critically important. And then one that's in the budget, that's not been on our radar, but was brought to my attention is ensuring that when reimbursements are changed for Medicare, if they go down, that the reimbursement for our Medicaid not also go down. Well, I'll be looking at that budget. I don't think it's something we take. FQHCs, I think that's an issue that it's being worked out, from what I understand. The FQHCs by primary care and the agency have been in the conversation about how to resolve their differences on that area, but it is critically important. We put a lot into in the budget, we'll see a lot of criminal justice reform, but the recovery centers that we have and the transitional needs that we have are significant. So I think we have a neat list. I just, go ahead.
Can I ask what your priorities are?
I just listed.
Oh, okay.
I said my number one
Okay.
priority is SASH. My second priority might be the DAs and SSAs ensuring, and the DNAs of the world, that everyone is stable. And then we have Empty Arms, they're empty, and if we can get them started up, that would be a good thing. And then the cultural liaison at the Howard Center is critical. Everything that everybody has said, so it's a good list that we have. And we have our set of bills that no one has put out. There's a copy. Do you have an extra copy there for folks? Yeah. And
Thanks.
Do you want me to run through real quick? or-
yeah, but really, and what I'm gonna ask is that if Amy, are you listening?
I am, I'm writing it down.
Yeah, so you and I can just sit together,
Yeah.
I've got a list. I don't know how we can prioritize, except I do think that SASH goes at the top of the list. Does anybody disagree with that? It's a 2-year pilot program. It's
It's not that much money, so.
yeah, okay. So, we'll just make a list, and then I will talk through the list with appropriations.
But again, I don't know, because it's a housing program, is it even in, do you know, Molly, is it in any of the housing bills? Is it coming up in?
No, this is not,
Okay.
it's not, yeah. Or disabilities language will be in there. And
And then the recovery center for Vermont Juvenile Justice.
yes, I got that,
Okay.
definitely.
For the record, all 9 Joint Fiscal Office, we threw together this sheet to help put all the bills that have come up from the House or bills you've passed that have budgetary impacts all in one place. So
215 is here,
what bill?
the S-215, which is the,
I didn't do a fiscal note.
Yeah.
215. What was 215?
it's the EBT, the expansion of the restaurant program.
Did that have fiscal implication?
Yes.
Yeah.
Okay, well, I never did know that.
Oh, okay, so,
Wasn't brought to my attention.
Okay.
There's a position in it.
It's down there and we know it's there, and that's the one where we need to get, that's the one actually where it would be helpful to have the advocates provide, a replacement language that is not an implementation plan.
Okay.
Okay, and I'll see if what I can do with that.
All right, so then all the bills except for 215. So you've got S98, which you passed, and that is all, you'll see there's GF, FF, SF. So GF is general fund, FF is federal funds, and SF is special funds. Then I got expenditures and I got revenues. So you have the agreement with Care Board, 2 positions, 245,000, and you have a contract expertise, which was one time for 250 for a total of 495. And that's all special fund. H72, there's 2 million from the evidence-based education and advertising fund, and then 300,000 from the opioid abatement fund, so it's 2.3 in special fund. Then that bill, as passed the House, also increases the manufacturer fee by 0.5%, which brings an additional $1.3 million. So that's what you're looking for. That one, H233, the pharmacy benefit manager regulation one. There's $405,000 for 3 new positions, and it also raises money, raises $406,000. So it's trying to be net neutral with the goal of the House with that one. In H622, there's 2 big things in here. One is the Medicaid reimbursement from non-transport. That's $74,000 gross. You see I broke it out by general fund and federal funds. You have the EMS training fund, $300,000 goes to the EMS training fund. The first year, 150,000, one half of that goes towards the work of the EMS advisory committee. The other 150 would go towards training, and then going forward, all 300 of that would go towards training. And it increases the allocation fee on insurance companies also by 300,000. So they would be a total of $450,000 going to the training fund, because there's already 150,000 going to it. You have the 721, which I won't go through because we just did that. There's 766, which is prior authorization. There's no fiscal note on that. The fiscal implication on that would have been if there was an impact to the state employee plan, but according to the state employee plan, there is no impact on their premiums, so there's no fiscal note. And then finally, you have H79, which is a temporary shelter. This is confusing because there's money in the budget for 25, but H79 starts everything in fiscal year 26. Goal of the House was to try to align what they were doing in the budget and with what was going on in 79. So there's a fiscal note on it, but there's no fiscal year 25 implication. 26 were still to be determined because a lot had new information that come forward to us from DCF after the bill had passed. The costs are a bit higher, but a lot will depend on what policy decisions are made for the legislature, how many days, how many beds, who's eligible, who's not eligible, et cetera. So that's sort of to be determined what the fiscal year 26 costs. That is a very, very, very quick run through.
That's fine, and, obviously, we haven't passed 721, 622, 766,
Anyhow,
233.
these are all, only one you did was S98.
Yeah, there, and so there's a lot of work going on to try to balance all this out, and the recommendations that we're making on our little short list here is really related to revenue that comes in and what might be possible to fund, but also when we find that we have some, I wouldn't call it surplus, but when we have some dollars to spend, we'll make a recommendation where to spend it. We're not the only committee doing this. You know that, right? So it's how those priorities get debated in the committee.
Did you say this and I missed it? Why is there no fiscal 766?
Because the implications would be on whether it impacted the state employee plan. We're looking at it from the state budget standpoint,
Okay.
and I was told by the state employee plan that the bill was passed without implicating.
Oh,
So that's why there's no, now to the extent that there's impacts on premiums, that's the whole conversation, right? I'm only coming at it from the standpoint of the impact on the state employee budget.
Yes, thank you. Okay, questions? So I'm giving Amy my list. I've put SASH at the top because I heard more people saying that. I heard more people saying BAs and SSAs. And then there's like a whole lot of ones and a whole lot of twos, so everybody's on it at the same level. I'm not sure we can put anything in an order of any order, but I think we do feel that SASH is pretty important, you know, we've got EMS training that's pretty important, and we've got everything that's pretty
Everything's
important.
important.
Yeah, it is, so,
What's helpful in this is, at least for those bills, it shows you what's special fund versus general fund, and that
Yeah.
changes the conversation.
yes, it does.
Very
Especially,
impacts the conversation.
we've actually done a good job on that in here and trying to look at special fund areas. Okay. And Amy, if you can put something together for us that we can look at before it gets sent down the hallway, I wanna make sure everyone has it in their hands and understands what it is.
We'll work on that.
Thank you.
Yeah.
Thanks for being here.
Yeah.
Okay, thank you, Nolan.
You're welcome.
This is terrific. Awesome. See, that wasn't so bad. There's food things that are horrible.
Yeah. Yeah, we look, say briefcase. In like LG, well, it was, because he was having this constituent, so they moved it into this area.
Okay, so we're moving on to H72 with Michelle. You're here. We've been missing you.
Oh.
Thank you all for being patient with our process. Thank you for this. Oh, and one thing that we didn't talk about with respect to budget are the compacts. And just so you know that we did talk about the needed money, the Secretary of State has put in that request, so.
That's on the gov list.
Yeah, I-
As well.
Oh,
Yeah.
good, yeah, well, then we don't need to have it on.
I should have put that on the list.
Yeah.
Um, There's $67,000 in the House tax budget.
Right, and it's in the budget.
So yeah, I put it on gov
That's good.
which I sent to your, to that. Yeah, so,
Have I looked at you? Yeah.
no, I hear you. I know. It's still, I don't recommend it. It's brutal. It's brutal.
Emails become a problem. Hi. So let's move on to H72, Michelle. I think we're at a place where we need to look at the draft, next draft.
Is it 1.2? Is that the?
It's still the draft that you saw, that I did like a really quick walkthrough last time.
Yeah, we want to walk through story.
Okay.
I think that's what we'll do. Maybe you could remind us what, as you go through it, I know because it's a whole new organizational structure, and so it's difficult to see where policy differences may exist. So
Sure. I'm happy to go through it slowly.
there's no yellow.
No, yeah, not yet.
And you'll put
Oh,
I'm
okay, so there might
gonna live
be.
that down or
Never,
whatever.
never, that's,
I-
Clark is going to get.
I love the
blamed.
yellow.
No
Yes,
yellow.
you do.
The yellow.
Yellow is helpful. I
It is
agree.
helpful.
But when the bill would just.
When
be
it's all yellow.
then it's-
Wait, I can remember, I don't know whether it happened last year or not, but there was a bill we were looking at that had yellow,
Blue.
green.
Yes, I remember
And
that.
red.
That was
That was
Katie,
it.
wasn't
That
it?
was Kate.
Yeah.
That
That was
Couldn't
great.
see the green.
Yeah,
That's
yeah,
the only
that
one.
was fun.
We love you, Katie.
Yes.
You're listening.
Oh, this is great, thanks, Michelle.
Sure.
So we're taking a look at draft 1.2. And so this is the same draft that I presented. I don't know, it's all sort of blend together, but the last time, let's put it that way. I think it was this. And I'm just gonna go through it more slowly. So just talking in generalities, the differences from the proposal from the House. So I have restructured some. There's a couple reader assists in there. So it's divided up into the OPC sections in the first half, and then the syringe service programs in the second half. The things that I've done differently in this is I took the OPCs out of the Good Samaritan law, created a new, its own section in chapter 84. Added in the recommended language from the Vermont Medical Society, and their comments on with respect to liability, as well as the comments that we received from the Mayor of Burlington and conversations with Burlington Fire Department. The funding is different. There's also, instead of multiple, the possibility of 2 sites, there's 1 site. It is specifically designated to be in Burlington.
But it doesn't preclude having another.
It doesn't preclude because you have the enabling legislation.
Yeah, okay, and so we can decide, and we also, I just wanna stop there and say, we can decide to add more money into our recommendation.
Correct.
Depending on what we have.
Yep. And instead of the money coming from that evidence-based fund, it would be coming from the opioid settlement funds, for that. Still has the study. And the $300,000 designated for that study. And then on the syringe service programs, it brings over the exact language from the budget, but adds a little more language about clarifying that the intent is that the syringe service programs be expanded throughout the state to be providing more services in underserved, particularly rural areas.
May I ask a question?
Yeah, go ahead.
Is there still a piece in here that requires, agreement from, a local governing body like a city council or?
That is, I mean, we'll go through that and that, I know that some people might have, be proposing that you don't need that, but I just,
It was in
I have-
there, it was in the House bill.
it was in the House
We haven't
bill,
talked
so,
about taking
yeah.
it out or leaving it in.
But I know that's one of the
We'll do that.
topics you're gonna be discussing, so.
Just want to make sure since the yellow is the yellow.
Right. I promise will be some, yeah.
Science has to be.
So, taking a look at section 1, so this is your new section 4256. Subsection A is, what is an overdose prevention center? Do you want me to kind of just go?
Yeah.
over this so that we can
we'll
just
go
really
through.
be like, okay, we're
Here's
good with
what we'll
that,
do.
we're good with that.
We've got until 11:30. Let's go through the bill and look at it and let's find the policy decisions that we have to make. So if you get to a place where there's a policy decision, like for example, the approval of the town or the number of centers, then we'll stop. and have-
Okay. So in subsection A, talking about what is an overdose prevention center. So 1 being it provides a space supervised by healthcare professionals or other trained staff or persons who use drugs and consume pre-obtained drugs and medication for substance use disorder. 2 provides harm reduction supplies. 3 is new, was not in the House bill, but it would also, OPCs would provide drug testing services.
Sorry, Michelle.
Sorry.
Yeah.
That's to make sure that what the person is using is not going to kill them on the spot.
Right.
4, answer questions on safer consumption practices. 5, administering first aid if necessary and treating potential overdoses. Top of page 2, providing referrals to treatment, medical services, and social services. 7 is educating participants on the risks of contracting HIV, viral hepatitis, wound care, and safe sex education. 8, providing overdose prevention education and distributing overdose reversal medications. 9 is educating participants regarding proper disposal of needles and syringes. 10 is providing reasonable security of the program site. 11, establishing operating procedures for the program as well as eligibility criteria for participants. and 12 training staff members to deliver services offered by the program. So that's kind of like your outline of what an OPC, the services they're going to be providing, and then in B is where you have, I know this is a decision point, policy point for you, is directing the health department to be adopting guidelines to kind of fill in the details around those pieces. And so when you have Burlington applying for the grant monies, they would be, putting, kind of structuring, saying, here's how we meet these 12 things under subsection A, here's how we meet the guidelines. So B is that the Department of Health would be working with stakeholders and health departments in other jurisdictions that are running these types of programs. That also, I'll just note for your yellow pen there is, it did say in the House version, other states. It's been changed to other jurisdictions because there's a lot of the OPCs in Canada and other places. And on line 16, you'll see I just put the kind of as a placeholder, the date for having the guidelines developed at August 15th. That's just a policy decision for you. I wasn't really sure where you wanted to kind of put the timing there. Because you're gonna have the guidelines in place before Burlington can, put their proposal together. So I don't know kind of how far out you're looking at doing this or having the site up and running, or how long it would take the department to develop the guidelines. I'm assuming there's a lot of guidelines already out there and that are running them. But
Yeah, go ahead.
So this is something that I was just informed of. A lot of people are smoking their opiates. What protection are we gonna have for the people that are there that are administering the site?
Well, I think that would be something that would be in the guidelines that they would be developing. I'm sure that, I'm obviously not the expert on how these OPCs are run, but you've got a lot of people who have been helping you with this issue. And I did hear some of the testimony that there were, as you said, a lot of people are now smoking instead of injecting or snorting. And so, my assumption is that they have figured out a way, to accommodate that for the safety of other participants, but as well as for staff who's there at the location.
Thank you.
Okay, so the date, August 15th is very close to July 1st. When does this
Well,
go?
I will
When does
say,
this go in passage?
I put this on passage.
Okay.
Because I was looking at it and there wasn't anything in there that, because of there's dates in other places and the money is for FY25, things like that, it didn't necessarily seem that you needed to have it take effect July 1st. And if you have it take effect upon passage, I don't know, maybe it's not that much of a difference, but at least it gives the time.
I was just thinking September 15th might allow for people to have a little bit of a break.
Nice to be to them a summer.
We all need a little break. So let's try September 15th. The House can disagree with this.
Okay. So the operating guidelines are to include the level of staff qualifications required for medical safety and treatment and referral support. And require an overdose prevention center to staff trained professionals during operating hours who at a minimum can provide basic medical care such as CPR, overdose interventions, first aid, and wound care, as well as the ability to perform medical assessments to determine if there's a need for EMS. So that was the language, that end language was what was recommended by the Burlington Fire Department that they had asked for.
Will it require licensure or certification?
Well, you have online, starting on line 16, the language that came from the House, which is that the guidelines shall include the level of staff qualifications.
Okay.
Yeah.
All right.
So I don't think there's
I
a
don't want to get
presumption.
defined where we have to have 5 MDs and 6
Right.
RNs and.
Right, I mean, I think if you, you might wanna. if it's important, that you wanna make sure that it doesn't only require licensed
Don't wanna
staff,
require
you know,
only
you might
license.
wanna add something in there
Yeah,
to
let's
just
do that.
to clarify that point.
Yes, let's do that.
How so, Michelle?
I don't know. But I'm sure that, probably some of the folks who, work a little more in this area with.
Doesn't say
healthcare
licensure.
It doesn't, I guess what I'm just saying, you know, I'm your lawyer, so I'm always trying to think about, you know, how is your legislative intent gonna be carried out? Is it possible that it, you know, the language is a little open-ended about including level of staff qualifications? Could it, for safety, for treatment and referral support? I guess I'm just wondering, whether or not, you know, could you wind up with the Department of Health adopting some type of guidelines that are much stricter than perhaps is your intention? And we wouldn't want that. And so I would ask for you, to give me guidance, or, you know, if there's
I guess.
folks
for
here who
now,
have
If
suggestions.
there anyone in the room who has understanding of requirements that have happened in other states or in Canada, be in the corner.
Yes,
Do
you
you
can
have?
send me some. Rhode Island, David Mickenberg, on
Okay,
behalf of their policy alliance, Rhode Island has specific language in their regulations that gets.
did you send that to Kiki?
Sure.
Can you send that to Michelle and to Kiki?
I've already, yeah.
Okay.
Okay.
Good. And we'll look at it. Let's keep going.
Okay. So page 3, this is the section that you had inquired about, Senator, which is that, in the House version, an overdose prevention center shall be permitted to operate within a municipality only upon the affirmative vote of the legislative body of the municipality. So that would be, you know, the city council or the select board.
So here, I'm good. I put my select board hat on with my years of experience at the local level and also in here. And so then the question comes up for me. Is there any other medical facility for which we have put into statute this kind of requirement? I have, and because, and I go back and then I think about what's happened in different municipalities when a pathways has been proposed. Or another facility has been proposed and the neighborhood gets up in arms and then goes to the city council and says, you gotta do something. And the city council's response or the select board's response, well, we have zoning which allows this, and so this is something we'll have to do. So there's already zoning, there are ordinances. There's the capacity for citizens to present a petition, 5% of the voters, to put it on a warrant item. So all those things are currently in place, and so I'm wondering if this is the camel's nose under the tent for any kind of regulation of facilities that we haven't seen in the past. We put this in. This is, I think it's new. Maybe. Go ahead.
I don't know.
Oh, Senator Wood.
McEwen had her hand up first.
I'll be quick, just I having spoken to some colleagues in the building. The point was made, and I think it's a good one, that OPCs, at least historically, and I think the evidence points to the fact that OPCs are much more successful when they have buy-in from a wide range of stakeholders in a community. And that folks wouldn't want to forego this stakeholder buy-in and this approval because it could hinder the success of the OPC.
Well, it's still only the legislative body. It's not community buy-in by any means. And it
But they are part of the community.
I understand they're elected to make decisions like this, but it also could put a stop.
I'm just sharing what I heard from.
You know, no, I hear, I know.
Folks.
Uh, I have mixed feelings. Actually, the way you actually just framed it this morning
Different.
was different than I'd heard it in the past from when we talked about it. So
That on my stupid head, I'm sorry.
no, I'm saying what you said this morning, it made me think about it in a different way. And I agree with both of you, so I'm like a little bit torn because I do think, and everything I've heard, and I've heard a ton of testimony, believe me, on
course you have,
OPCs.
yeah.
I do think it's really important that there's community buy-in because otherwise it's sort of setting them up to fail. And we don't want these to fail, like I don't want this to fail. And there, so the question of what is the sort of like marker of community buy-in is difficult. I think this was an attempt at the House to try to create some kind of marker, and I appreciate it. On the other hand, I do hear you, Madam Chair. I mean, in other states, this type of thing could be used for, clinics. It could be used here
Yeah.
for abortion clinics. And that troubles me. On the other hand, so there's lots of hands. Now I'm on 3 hands. There is a precedent for, there's a precedent for, the compromise that we ended up coming to with the legalization of adult use cannabis, which was a town vote on whether to have the stores, the shops in towns. So I'm a little mixed, but I think you're right in that there would still be like a DRB.
There's ordinances,
And
there's
zoning
planning
ordinance and
commission,
stuff like that.
zoning.
But I do think if we were to take this out, and I'm still not 100%, I do think we need to put something in here about there needs to be some show of strong community support. And I think there has been in Burlington. Burlington has shown strong community support. Other communities have not. And if they try to do an OPC, it will probably
It'll
fail.
wreak havoc.
It will.
Yeah.
So if we do take this out, and I'm really mixed on it, there needs to be something about a demonstration of strong community support.
So some language that would say there's a municipal process, there's zoning, there's ordinances, there's something that supports the inclusion of an OPC. And this is a pilot program. And we've seen, maybe we could ask the pilot municipality to present how the municipality came to support the OPC. And that might provide us with the information we need to go forward. So asking, right now it's Burlington. Burlington's been through a lot with this. And it culminated with a council vote. Doesn't mean that it has to culminate. It doesn't have to begin with it. So the question would be, could we put something in here that asks for, when they give their report back, that they include in that the municipal process that validated having the OPC. That's one step.
Can I ask you a clarifying, when you say the report back, you're talking the reporting that the OPC has to do, or you're talking about the study, you're talking about the reporting that the OPC?
Yeah, something.
Well, you could also put it in the grant, you could put it as part in the grant language,
That's
is what you
better.
could say, is you could put it
Okay,
as
that's
part
what you
of their grant application.
Okay.
And we could move it out
sure.
of this statutory section and put it in the
Yes.
session law with regard to the grant application.
That's
But that's
good.
exactly what I was gonna say, because Burlington thank you, Michelle. Burlington has to apply for the
Sure.
grant. The city council is gonna have to approve their application, and that sort of is the city council's
That's good.
approval.
That's good.
Or the mayor's approval. There's a, municipal approval of applying for the grant. And so if we just make it clear that it has to be in there.
Okay, so don't require that they take a vote as part of the grant before the grant application, but that they, as part of their application, that they kind of show that there is support.
That it's been through a process.
Right.
It didn't just come out of nowhere, but what we don't want to do is we don't want to have this become a way for okaying other medical facilities. This is medical facility.
Right,
And I thought of the same one that you thought.
yeah, exactly, Madam Chair, and I think also, I mean, just thinking about my own select board, agendas, they always have to approve, some boards
Yeah, they
approve
approve
grants,
grants,
so this would be doing it through approving a grant application.
And so, yeah, the grant could say, that it meets, it fits with their zoning.
If you have suggestions or there's certain things you want in there, feel free.
Okay,
So, okay, move on to subsection D.
Yes, thank you, and we'll get some language there with the grant application. Are you okay with that?
That sounds good.
I saw you nodding your head, so.
Yeah.
Okay.
Yes.
I'm very concerned about the way it is here for other reasons, so.
yeah,
And we're setting a precedent that could be.
yeah,
Oh, thank you, that's the word I was looking for.
I hadn't thought of it that way, it's a great.
See, sometimes good things happen from community.
So subsection D, this is this is why you have me in here instead of one of your healthcare attorneys, actually, it's just this subsection, because that's how the bill started. And it was much smaller, when I started it. So this is, with respect to immunity, because the way that, as you know, this legislation initially started was, before you start talking about what are the policies and how do you protect workers and the community involvement, you have to say, well, how do we make sure that people aren't gonna get arrested for drugs? Because possession of drugs is a crime. And so subsection D is your immunity provision. That basically says that as long as an OPC is acting in good faith, in the provision of services that are outlined in subsection A, and they're doing it in accordance with the guidelines that have been adopted by the Department of Health, then they're gonna be afforded certain protections. And so in subdivision 1, you'll see these are the individuals and entities that will be afforded protections. So it will be someone who will be using the services of OPC. Be folks who are staffing or administrators, could be healthcare professionals, could be volunteers. Subdivision C also protects a property owner. So if there's a existing building or facility and the OPC, it's a private landowner, whatever, who's leasing that space, they would be afforded the protections. An entity operating the OPC, state or municipal employee acting within the course of their employment. So there, maybe a liaison from the city of Burlington who's working with the OPC. So those folks would be getting the protections. And then subdivision 2 lays out the protection. So the first one in subdivision A, at the top of page 4, is that they couldn't be cited, arrested, charged, or prosecuted for unlawful possession of a regulated drug. So they talked about it before. It doesn't cover selling or dispensing drugs. People are coming with their pre-obtained drugs, but they would be immune from prosecution, coming and going from the facility, and while they're at the facility for possession.
Go ahead. Ma'am, if I could,
Go ahead.
just a question on paragraph A.
That's fine.
From a legal perspective, from a state legal perspective, how does this bump into federal law? I mean, how does this verbiage bump into federal law and survive?
Well, so I think you have both federal law and state law with regard to regulated drugs. They are not required to be the same, essentially. So someone can be prosecuted at the state level for a possession charge under Title 18, Chapter 84, or they could be pursued under the Controlled Substances Act at the federal level. If you think about the state's experience with cannabis, right? So cannabis is still illegal. It's a Schedule I drug at federal level. It's illegal to possess it, to dispense it, to sell it. Vermont chose to change its laws there. That doesn't remove the federal liability for folks, so there always is some risk there, but that you don't have any ability to do anything about that. You probably already know has been litigation concerning OPCs, particularly with a facility in Philadelphia. There is, got it in my folder, I'm not gonna remember all the names, but there is a provision that was passed, I think, in the mid-80s. And it's commonly referred to as like the crack house statute, and there are differing opinions on whether or not that federal statute would or should apply to an overdose prevention center. Our prior Attorney General, T.J. Donovan, had signed on behalf of Vermont an amicus brief in that particular case. And was in the Third Circuit. It's kind of gone back and forth. There has not been a, real resolution or settling of the issue. And so just from my perspective, I just kind of look at it kind of like with the cannabis issue, which is, are there potential liabilities and risk at the federal level? Yes, you are trying to remove the barriers at the state level. And so anyone who is moving forward with an OPC just has to be aware of potential liabilities at the federal level. My understanding is that, the ones in New York City have been operating. What happened, again, I have so much more experience with the cannabis stuff, but years ago, there was something called the Cole Memo from the Department of Justice, and they basically had said to the states, because there were so many states coming online with medical cannabis programs, and they said, listen, this is not going to be a high priority for us. We have plenty to do. And so as long as you are kind of adhering to certain guidelines and you're trying to be really responsible about it, you're trying to provide a service to people who need it, you're really not going to rise to the level of like us wanting to put our money and our resources to going after you. And so, I'm not the expert on this. You've got a lot of people nationally, but I think to me, it closely mirrors kind of that, which is that you're removing barriers at the state level.
Good. No, I think it's worth your articulating that risk one more time for constituents and state. I appreciate that. Thank you.
Got one question.
Sure.
So if I'm a user and I wanna use the facility, come in, you test my drugs, it's clean. That it's okay to use it, it's not contaminated. So are they gonna get something that certifies that that drug is clean? So what happens when I leave with? If it's certified clean, I walk out, has it got the Vermont stamp of approval on it? So that people can sell it?
Well, nobody can sell it.
Okay.
It's against the law.
No, it's against-
This doesn't change that.
Right,
You
but not
also
saying
cannot,
they won't,
dispense it.
right?
In terms of, what they do there on the drug testing, I'm just not the right one to ask, I'm sorry, in terms of how the process of the drug checking, and
Right.
I don't think.
See, can you see my concern? Now I'm gonna walk out of here with.
I'd say I have clean drugs.
Correct. Is there a liability to the state because now they've tested that drug?
I think the intention is to say no by having this language, right?
I'm just raising it because, I'm concerned about it.
And last year, you'll remember, we did pass the drug checking, sort of pilot programs, and one of the benefits, and I would assume it would be still true for the OPC, is that the benefit to the state is that we would have a better idea, or the Department of Health would have a better idea of what is the drug supply out in the community, because we would have data on the drug supply, and that helps with prevention and recovery and heart.
I raised the same issue last year.
Yeah, it's not like you get a little
Right,
seal of approval, this is, for the state of Vermont stamped.
so
opioids.
you have to test that every time he or she comes back in.
I don't know that
There's not many requirements here, it's
here,
just a
yeah.
service that they provide, and I'm sure y'all have probably heard a lot more testimony than I have, but when I'm next door, I was working in the criminal realm and they had the state lab chemist come in
Mhm.
and, she had presented some data that, I think it was like out of the, all the glassine baggies that they had tested, 99% contained fentanyl.
So the testing doesn't mean testing for everything, it means testing. It could be fentanyl strips, period. So it could be a spectrophotometer looking at xylazine and ketamine and everything else.
So if hypothetically a individual comes in and they test and if 99% are testing with fentanyl, and they get test results, but they still take the drug and the adverse effects, who's liable? You've done the test, or we've sanctioned the opportunity.
They have a choice. They can use the drug or not.
Well, and sometimes first of all, the liability, that's the point of the bill, is that it's removing
No
the
liability.
liability, but also knowing what's in the drug doesn't necessarily mean take it or not, but it also can help with how much do you take or how do you take it, and how do the medical people there, what do they might need to prepare to prevent an overdose. So it's not just a black and white, take it or not take it, or use it or not use it. It's a, hey, now I know what's in this and I can understand how to dose it or how to use harm reduction methods.
And the topic of liability, my assumption is that once a individual comes in, uses drugs, they just depart. They may hang around for a minute or two, but they're heading out back into the neighborhood. Who's liable then for any kind of interaction they might have with the public or property damage or any of that kind of thing? I mean, my assumption
It's
is
the
they're
individual. I mean, if they commit a crime, if they drive while they're under the influence, they're subject to the DUI laws. If they commit vandalism or whatever it is, that individual is liable for their conduct. I'm sure that these programs have precautionary measures in place. So when someone uses in terms of, like I know when I go give blood, they're like, now you gotta go sit over there and eat a cookie and drink some juice for 20 minutes or, whatever it is. And I'm sure that they're trying to make sure that someone's as safe as possible upon leaving the facility. But it's really that individual is going out into the community, and if they commit a crime, they are liable.
I don't know how long does the buzz last? Is it minutes or is it hours or is it, I mean, how long is the impairment?
Again, I don't think I'm the right person, but I
I
think it
know,
really
I'm not,
varies.
but we've got a
Yeah.
lot of
It
people
varies on
running
the
hours
amount
to
and
this.
It's gonna matter on the person, how long they've been
Right.
using, how much they're
What
using.
their upregulation
Is it
has
minutes,
been.
is it hours? I mean, you gotta give us some sense of, because again, people are asking these questions to us and we're not.
Right.
We don't have this experience, but we have people in the room who may be able to just kind
So
of.
we did, so I would recommend going back to the Brown University, the information that we have received, and we got some really good testimony
I didn't see that.
from Rep Small too. No, seriously, a lot of these questions that you're asking are the questions that people have and the people in the community have. No question. But we do have testimony on that, so.
I know,
There's,
but can we just get the answer here?
no, I mean, we're not experts either, but some of us are, and some of us
Okay.
could answer that, but the goal for us now is to go through the bill and look at the bill based on the testimony that we've heard, using the data that we have in our heads, and then to make some decisions about what works best here. So right now, we've heard a lot of testimony about a safe place for overdose protection to allow people to inject safe medications, allow people to learn how to do that appropriately, to seek help should they need it. We've looked at all of that, so I just think we need to open.
So is there any responsibility for for the state to, like, pack of cigarettes has, you have full warning labels on it. If you buy alcohol, the state has responsibility to make sure those labels are
But
on
the
there.
state doesn't have a responsibility when you take a puff of menthol.
So,
That's your independent responsibility. You do it, it's autonomous. And then when you get your lung cancer and we pay for it, it's your responsibility, not ours. I'm sorry.
So I-
But
so I'm just
it
looking-
gets to that.
I'm just looking for answers to, because
Yeah.
you're gonna want me to sign on to this bill.
I do want you to sign on to the bill.
But if I don't get the answers I'm looking for, I'm not gonna sign on to it.
What I'm saying is we have the answers in our testimony.
What is your question, Senator?
So is there any responsibility of the state to warn these people
Oh.
and in writing or to sit down and counsel them before they actually use the facility?
So a couple things, the state isn't selling or even allowing the sale of the
No,
drugs,
I
that's
know.
different than cigarettes.
But we're
Cigarette-
sanctioning the site
state is
companies.
allowing the sale of cigarettes, so the state is
We're
not.
sanctioning it by providing the
So the
facility.
question is liability.
But wait, I'm trying to answer the question. So first of all, it's
Yeah, I
different than
appreciate it.
cigarettes. It's not, we're not allowing sale. As our council said, these drugs are still illegal. This does not make them legal. It just allows for people who have substance use disorder, who are using these substances, it allows a safe place for them to do it. And it provides things like counseling on the safe use or access to recovery services and prevention services. That's part of what's provided.
So is that written in the
Yes,
bill?
it is.
So now, right, and anyone can sue the state. We can have a lawsuit based on the laws that we pass, and then once it gets to a Supreme Court, it could go to Superior Court, go to federal court, and go anywhere, and the lawsuit would play out in terms of what has happened based on the legislation here and what's happened in the center. So we need to make sure that what we have here provides protection for the people who are doing what we see as, medical protection. And, it's 11:25. We're in a really good conversation. Oh, go ahead, Senator.
My question is not, it's the liability of the state, which I'm targeting this for a better understanding. I think we can
Yes,
let the
yeah.
conversation sit. Is it time? But
Michelle's the one to ask that.
I did ask, that's what I'm trying to do.
Okay.
That's my exact point. I'm trying to figure out what is the liability of the state if we pass this. That's the basis of my question.
Can you answer that? It doesn't have to be right now, but.
Yeah, we can pause because we do need to go.
Well,
to
can I also just recommend that people in this committee read the bill and go through all of the testimony that we've gleaned and gathered over the last, 3 months?
And I've lead it down to that question. Thank you, Senator.
So, and then the question for you, Michelle, we're gonna come back to page 4.
Okay.
And we are going to go through the liability section. And in the meantime, maybe there's a way we could understand the state liability for passing this legislation. Because that's what it is. And a state liability for an OPC that has received a grant from the Department of Justice. We get
Thank you.
it. That would be a
So I will,
fun lawsuit. I gotta tell you, I need to defend it.
I did just want to just leave you with one thing that can
Yes,
help you think
please.
through it, which is the state licenses and inspects cannabis stores that are selling
No, I get that.
drugs in violation of federal. So I just want to, just again for context.
So when you say,
It's
what's, wait, can I ask you, when you say what's the state's liability, do you mean what's the state's liability with respect to the OPC? What is the state's liability with respect to the person who goes out on the
Oh.
street? Oh, they're two different questions.
Yes, absolutely. Yes.
And so we want to finish this bill. And we're gonna finish it. I forget when we have it, Kiki, is it Tuesday? I tell you what we can, but. We have it on Wednesday. We need to solidify this thing.
Yeah.
Vote. The latest on Thursday.
I think we should just set the vote for Wednesday and
Well,
you
we'll be
can vote
looking at,
yes or no, that's your prerogative. And you trying to delay it.
we are looking at a lot of new language, but we gotta do it. Because we got a budget.
I will need, after walkthrough, I'll need time to write an amendment.
Right.
Unless
That's
you're,
why I'm
unless it's
saying,
gonna look as.
We're gonna finish the bill on Wednesday,
Okay,
and we'll put down possible vote, but we may vote on Thursday.
okay. So, would you like me to come to the Wednesday meeting with moving
Yes.
subsection C to the
Yes.
grant? Okay.
All the changes that we've made,
Okay.
yes.